My presentation today was a Meet the Expert session about amyloidosis, diagnosis and treatment. And this was a crowded presentation. There were 30 people at this breakfast session, and there was much interest on amyloidosis. This is good for rare diseases, of course. We focused on diagnosis, trying to do early diagnosis. And we also talked about the possibility of screening in AL amyloidosis, which can sound strange in rare diseases. How can you screen for a rare disease? And I think we could look for patients at risk, that are those with a monoclonal gammopathy of undetermined significance with a skewed free light chain kappa lambda ratio. We have very sensitive markers to use in that setting that are NT-proBNP for cardiac involvement and albuminuria. And I encouraged hematologists, and as I have done in other occasions, of course, to screen their patients for early onset of organ involvement by amyloidosis in patients that they follow for MGUS. And then we moved to difficulty in diagnosis. Still, there are difficulties not only linked to late diagnosis, but also to difficulties in typing, because only specialized centers have appropriate techniques for typing. Unfortunately, tissue typing cannot be done with regular immunohistochemistry, because regular antibody seldom stain amyloidosis. So you need to have custom-made antibodies, or use immunoelectron microscopy, as we do at our center, or use mass spectrometry. And this is the first need for referral centers that we have in this disease. So most patients need to be referred to a specialized center for diagnosis, for have a proper diagnosis. This is relevant because there is not only one type of amyloidosis, but there are many. And they have a very similar clinical presentation. So you need to identify the correct type of amyloidosis, be sure that it is caused by light chains, and then you can start chemotherapy. Otherwise, you are treating with chemotherapy a disease that is not cancer. And there were many questions about that, because many institutions have problems with these techniques, but also referral centers are growing in Europe. And so they are looking for these techniques and these tools, and there are alternatives. So this was also good, I think. There were signs that things are changing, and luckily we have referral centers also. Then we moved to treatment. We discussed the role of transplant, the problem of the frailty of our patients, the role of biomarkers in staging, which is very important, of course, and new studies that are being concluded about novel agents in AL amyloidosis, and the role and the timing of different therapeutic strategies. This is a very interesting conference. I met a lot of friends, very many friends here. I had the opportunity of discussing patients and clinical case, and I am enjoying myself very much.